Sandy, it's good to see you. Welcome to the show.
Thank you. It is great to be here.
It's been a while. I know that you and I kind of email every once in a while, kind of trying to keep up on what's going on in the world of health coaching and all that. You're busy building a thing. I'm busy doing my thing. And so it was time. It was time to get you back because I think this conversation around coaching and agency is central. And I think that this is the time to shift the narrative with all the cracks in the concrete and all the stuff that's happening with healthcare, big and small. I think this is when the conversation around coaching and agency needs to come in a strong way. So just by way of intro, can you share with my audience what it is that you've built and how you got there?
Sure. Well, I started out many, many years ago. We're talking late 60s. What were the choices available to women? You become a teacher, a secretary, a nurse. Well, I chose education, and that's where I thought I would be. And I did for 5 years. I had a classroom, kids with special needs. They now call them neurodivergent thinkers. Their names for them are changing every decade or so. And even back then, I realized that there was a big gap, that kids were being tested, hours and hours of testing to determine if they had learning disabilities, behavior issues. And it was all about what's broken with you. There's something broken and you have to be fixed. And at that time, ADD really didn't even have a name, but it was always looking at what's the right diagnosis so that we can just have this treatment, whether it be medication or an educational approach or a psychological intervention. And I started getting very interested in something that didn't have a name really at the time, mind body medicine. We didn't call it breath work. You're just teaching these kids how to breathe, using bubbles, teaching them to blow bubbles, teaching parents. I was doing workshops for parents, for teachers, stress management, writing articles about that, which then led to getting a doctorate in clinical psychology. But that field, at the time, I used to think I was a terrible diagnostician. What's wrong with me? I'm focusing on people's strengths and how they thrive. And at that time, positive psychology didn't really have a name, but I started doing that. And when it did come into being in the 90s, that was what I focused on. And I was a health psychologist. So I was helping people. Doctors were referring their patients to me who had things like migraine headaches or panic attacks associated, and also had IBS, for example. And they would say to these patients, well, I don't know what this lady does, but my patient seems to do well, so I'll refer you to her. And that then led to a desire to learn something that was very new at the time, the 2010, functional medicine. And as a psychologist, my scope of practice was such that I could not order labs that a lot of functional medicine doctors were focusing on. But what I could do is teach. And people were coming to me to say, hey, it would be really cool if you trained, these were health coaches who had trained at other programs and were out there and really feeling lost. They didn't have much guidance in terms of follow-up support. And so that's what I chose to do. I was around 65 at the time, and that actually was 65. This was like 10 years ago, and started a school to train health coaches. And right now we've got about over 5,000 around the world. And this is really my mission and purpose, because I imagine these coaches that we've trained that are now going on to helping people. And then those people that are being helped, they are spreading the word with their loved ones. It's this giant ripple effect. And it feels like now, at the first time, and I've been doing this for like 50 years, that there's this real awakening where people are wanting to take charge of their health, and they are awakening to that there has to be a better way. It cannot be just our conventional medical system.
Yeah, amen. I'm so glad you did it. Selfishly, I've
Mhm.
hired probably 2 or 3 of your graduates, and they're my best coaches, and
Aw.
they're great. And the reason is because of the whole systems thinking. The reason is that they are looking at the whole human. I had an experience, I don't know, a couple years ago in Park City where they're like, "Oh, your insurance covers this, like, nutrition dietitian thing. You should go." I'm like, "All right, why not?" It was awful. It was someone running the numbers and just being a grunt of the system and literally not understanding how to think outside of the really small, calories in, calories out issues that they've been trained about. And I said, well, I have a gluten issue. I have a dairy issue. And they're like, you're one of those weirdos. I'm like,
Oh.
no, I don't fit into your mold. And so that has become the patient population, because all this stuff, right? The glyphosate, the seed oils, the whatever you want to say can harm us. And so all these people live in a very complex world of food, of news, and of social, behavioral, all the stuff that you had learned as a psychologist. That's also there. So through that lens, how do you train coaches to look at the whole human and understand that it's not just the green smoothie, it's not just the exercise, all of it?
Yeah, so I have always been a proponent of integrative work. And so I have seen people who are stuck with one theory, whether it's one dietary theory, one psychological theory, and that's their identity. And so everybody who comes through the door will get that one way of thinking. And they'll attempt to help that individual based on their philosophy. And what we teach at FMCA is, first and foremost, it is you shed your identity basically when you go into a coaching encounter, because it's not about you as the coach. It is about that individual. It's what are their beliefs? What do they want? And you ask the right questions. So the essence, how we teach it is through questioning. You coach by asking the right questions, asking things like, what matters most to you? And then how you intervene, how you support somebody would be to ask those questions where they're starting to then really reevaluate their thoughts, like how they arrive, maybe challenge them a bit. Like, okay, prove that. If they'll say, oh, I had a horrible childhood, nothing good happened to me. Well, that's actually false reasoning. So you prove it. What do you mean? And then tell me about a time in your childhood where you had a good time, you enjoyed yourself. Any pictures that you can think of that were taken of you, photographs, and where you were smiling and laughing and things were going well. And they'll say, oh yeah, and so that will then erase that all or nothing thought, like I had a horrible childhood. And it's a revision to, well, parts of it. There were some times that were very uncomfortable, that were sad, that were painful. And so that comes from cognitive behavior therapy. And coaches are not therapists, but they can ask the right questions to where somebody is now starting to reevaluate their perspective, what they're telling themselves to be the truth, which may be full of holes. And so once they reevaluate that, it's a profound change. Coaches also integrate that at the same time with the systems way of thinking. So it's not this just everything is in silo. I have a pain, I have a rash, I have a bad experience, and that is in isolation, but really starting to see the whole gestalt, the whole picture, and putting together, for example, rather than in your example of, oh, it's all about calories. Well, a health coach will focus on not just food as nutrients or choices you make in terms of, I'm going to eat this because it's healthy, but really digging into more of the why, which comes from eating psychology. That's a big part of coaching, helping people to see that the choices they're making, what they're choosing to eat, how they're eating, why they're eating a particular food, really is a reflection on many different things. Not just their information about that food, but their way of eating, their family myths that were passed down about food, their culture, their heritage, their peers, advertising. So many things go into it. So it's really a very complicated, but I wouldn't say complicated. It's a picture that is many different elements coming together. And that's really the essence of coaching. It's not just one orientation, one way of thinking, I'm just going to teach you what to eat, for example.
So many of these folks that come into these online forums or listen to the podcasts and all this, common complaint is, I can't stick to a damn diet. I'll do something, I'll sprint, I'll lose a few pounds, I gain it all back. I hate myself. I'm such a loser. I really suck at this. And that narrative keeps reinforcing itself because you do it 2-3 times a year. And after 20 years, that's kind of what you do. So, and again, this is a complicated case, but it's it's a common one, unfortunately, is how do we begin to decouple that, right? The feelings of self-worth, the I fail at this, last time it didn't work, so this time I can predict it's going to
Mhm.
happen again. Like help me understand how you would start to unravel this.
Yeah. So that is all or nothing thinking. I failed. I'm not doing well. I cheated. I blew my diet. I'll never be successful. And it's really a reasoning error. And so it's helping somebody to have the sense that it's wasn't all or nothing. So you ask that many different questions, but first and foremost, it's um, tell me about what happened. Like let's take when you first, let's say they were going to eat certain foods for dinner, and they went beyond. And then after dinner, they had a snack, and maybe they had too much of that snack. So, for what you would do as a coach is guide them through questioning to see that initial part, they were successful at maybe they had 4 ounces of protein. Maybe they had some vegetables. Maybe they finished that. They had those vegetables. So that was success, and that stands as opposed. And so it's really a reasoning error for them to then conclude that they blew it. So 100% of the meal, 100% of yesterday was bad decision. Then they might say, well, no, I was compliant for dinner. And the other piece would be to help them start to feel some emotion that's positive, that is associated with joy. Like as you taste, let's say, a vegetable that they're eating at dinner, can you experience joy of the taste of that food? And then if you have, let's say they thought about not snacking. Well, the compliment where they were successful is they had that thought. And yeah, maybe it lasted for 5 minutes and then they broke into the snack bag, but it's success for that 5 minutes. We used to do that when I was teaching special education. So it's data collecting where you're saying, okay, well, today, maybe for 5 minutes, I was able to withhold having that snack. But then the day after, you can see I took that same data, it would extend it to for 6 minutes. It's getting longer. So we're trending upwards. And so you're starting to, it's like breaking it down in same way with a child, in my classroom where they they wouldn't put on their coat. Well, they would look at their coat. Okay, that's success. That's day one. Maybe then the next time they start to bend down to put their hands in the sleeve. That's another it's path to success. So in this case, that's what I would suggest is really kind of reevaluating that, to be catching the all or nothing thinking. And you maybe extend it, well, throughout the day. Maybe dinner they ate too much, but what about lunch? What about breakfast? Maybe that was a win. And so they're starting to then break it down and seeing these slow approximations. And then you could set goals for that process to continue.
This data collection, it's really interesting. It's like a filter through which I think a lot of us have inherited this all or nothing kind of ideology, right? It's like I failed at this, therefore I am a loser, I am a failure. I'm wondering if was there like a certain point in our history where that became a dominant ideology? Is that something that's kind of crept in over time? Just as a student of this, like where the hell did this come from?
Yeah, I think it's normal. And the more we normalize it for people, there's something wrong with you. But this is how we all think. We all we may be not doing it in one area, but there might be another area where we're doing this. So maybe we're saying, we can manage our eating. But maybe in our relationships, maybe we fly off the handle. Maybe we're too quick to blame a loved one. Oh, she shouldn't be doing this. If only they would change, my life would be different. My marriage is awful. My kids don't listen to me. Again, it's all or nothing, catastrophic thinking. But if you break it down, it's not that my kids don't listen to me. It's some of the time It's some of the time we get into arguments, but was there ever a time your kids listened to you? Like, yeah, okay. And the same thing with this woman. Was there ever a time? Like, it's not that you're failing. Let's look at the times when you were successful and build on that. And then let's move on from this meal. Okay, let's really talk about the next meal. And there's something you can do, stress inoculation, where they think it through. What are the ways? How am I feeling when I am about to eat this food? How can I do this differently? Can I apply 20 seconds of courage to refrain from having that snack where I would then judge myself that I blew it?
One of the things that keeps coming up is this kind of campaign-based dieting versus a healthy lifestyle. And we have all kind of fallen into these. It's like, I think of like the quarter system when I was at UCLA. It's like, 10-week sprint, finals, take a week off, get fat, right? And so how, as someone who works in training health coaches, how do you shift these ideologies into saying, no, this is just how we eat? And the caveat I'm going to say there is, I find it all to be a pain in the ass. Like, oh, how many ounces of chicken was in that meal? You know what I mean? Like, the accountability to like what went in the mouth is so hard for people. And I'm a guy in the industry who hates doing it. So how do you slowly train that over?
Yeah, so I think it's taking charge of your health is truly understanding what is going to work for you. That just because somebody says, write down every morsel that you eat. Well, personally, for me, I could never do that because I don't like micromanaging. I don't like weighing my foods or counting up how many grams of protein, even though, I'm supposed to, according to Gabrielle Lyon, 1 gram of protein per pound of body. But I eyeball it. Because that's how I've always been. I know my personality and what will work for me versus if I was told by somebody, you must, count you have to weigh everything and you have to look at grams. And so somebody else, though, might really suit them. And they love looking at that data and they're really good at that. And so it's really having that sense of knowing how you function best. And to be able then to say to a doctor, a dietitian, coach, this is how I'm going to do it. And that's truly taking charge of your health. So, for example, if with the idea that how you're going to eat, for me, I think about my future self. And the decisions I make, what I put on my plate and how much and when I eat is based on, well, I'm eating for my future self. And that really works for me. And what's great about coaching is that they're really helping people to have that aha moment where they make that decision to change, but it's based on real self-knowledge that this is going to work for me because I know myself.
That's really empowering. Just thinking of the example of the registered dietitian, that I went to, it was disrespectful, right? Like, here I am, a grown man, telling you, the stuff that I came in with, and before I could finish my sentence, she kind of talked over me and said, "Listen, here's what you're going to do. Here's how you count your calories, and I'm going to manhandle this because you're obviously an idiot, and I know what I'm doing." And that, is kind of a microcosm of the allopathic medical system in general. Is just like, shut up, I'm the expert. And she didn't know who I was. I didn't tell her who I am. I'm not that guy, right? But I was just like, what? This is what my patients feel like. This chick just pushed me around.
Yeah.
And said my way or the highway. And it was completely disempowering. And knowing my personality, the answer immediately was, screw her. I'm not listening to her. I'm not doing this. She could go, jump off a bridge. And so it was a complete backfire. And I don't see that inside the system as much as I see it outside. I see it with health coaches. I see it with people you train, but it's kind of like a unicorn thing still, which is why you're probably still working, is to get this type of training out to more and more people, because this isn't normal, right? This is unicorn stuff.
Yeah, first of all, we've lost so much in our modern healthcare system. So back in my day, in the 50s, you went to a doctor, it was a family doctor. They knew you. They actually knew your name. They knew your family. They knew your dog's name. It was truly community medicine. And you felt like you could tell this person anything, and they listened to you, and it was called bedside manner. And there's been study after study that shows bedside manner, empathy, where you are offering hope, you are with someone, that is then it's a trusting relationship. And so what we've gained in our acute care medical system, which is, state of the art trauma care. So I want to be clear, if you think you're having a heart attack, you don't go find a health coach, you go to the emergency room, you get the best of acute care medicine for that treatment. But what happens when you're discharged? What then? And that's where the health coach comes in, because then you don't need just a list of instructions, eat this and not that. This is what you should be doing. You need someone who's going to truly listen to you, because the big problem is people are not feeling heard. They're not acknowledged. If they have a doctor at all, which, there's such a coming shortage, and there is a shortage. Primary care offices are closing. They're becoming boutique concierge medicine. Their practices are filled. Long waits to even see a doctor. And then you get into your appointment, you're given 7 minutes, 10 minutes. You don't feel heard. And the doctor's out the door, and they are really just focusing on what meds are you on, let's refill this, and that's it, out the door. And and even people who are in the field, physicians who are caring, who want to serve their patients well, are hampered by constraints. They have to see so many patients in a day. They have so many forms, and they have to, their EMR, they're in the record, as opposed to really looking at their patients. And what I see as attempts at solutions are all AI. Well, we'll just have better precision diagnostics. But that patient is ignored. I had a friend who just had a hip replacement. She literally never saw the doctor. It was just somebody came in with, greeted her and told her the procedure for follow-up discharge. Somebody else came in, but it was just the nurse or somebody that was an assistant. But the doctor never called, never came in to see how she was doing. And that's really where we're going. And so where does that leave somebody who has a chronic illness where acute care medicine was never able to treat? They're out of luck. And that's why I'm so passionate about health coaches, because when you're having an encounter with somebody who is not that expert, when nobody likes to be told what to do, it's you're being bossed around, and it may not fit for you what you're being told, as was your example. But the health coach is really as that individual, that client, you are in the driver's seat. And the coach is your guide, your ally, and people are they are not as reticent to talk about things that might be embarrassing for them or shameful, or they're going to tell the coach because they see them more as their peer, who's also not going to judge them like the doctor would.
Yeah, and if you are any versed in human contact, you know that it takes a minute to build rapport, to open up. And in 7 minutes, you're not telling anyone anything, right? And that is a big problem. Another problem, and you just wrote a book about this, which I'd love for you to talk about in a minute. Your health coach, your coach will see you now, which is great because it's a real spin on the system of how the doctor is, the dominant ideology, and how you got to wait around, and this person is going to bless you with their time. This is a person who's going to share time with you and share space with you. And a lot of people listening to this are like, yeah, that sounds great, but I can't afford it. Right. And that's the biggest problem in healthcare, is like, I'm paying Blue Cross $1,500 a month, and they don't pay for crap. And now I got to go pay out of pocket for something. And right. And so I've been playing a lot with models of group coaching and a lot of the things that can help scale this type of care in a way where you're not paying one-to-one synchronous, because you got people's time is worth money. And so I'd love to hear some of the innovative models that you've been working on to help scale this for people to maybe spend a little less and still get value.
In my career, I have led all kinds of groups. Groups are so powerful. The community then becomes the medicine, and it is affordable because often there's something that's been around for many years, a group medical visit. So there are practices that are insurance-based where, let's say you get 10 people, the coach facilitates the group. and then one at a time, and it can be done over Zoom, which is HIPAA compliant, that each individual in the group is taken out and seen by a doctor, nurse practitioner for their session. And then the practice will bill those 10 individual sessions. So that is something that's a possibility. And I wish that every primary care practice adopted this. It would dramatically lower healthcare costs and dramatically reduce the incidence of chronic disease. When you are with a group, you're changing together. It's social proof. The idea is, oh, if that person can do it, I guess I can do it. And so we're in it together. And that's some of the things we've so lost. So it is so critical, because loneliness, as they're saying, is an independent risk factor. It's worse than smoking. We are alone most of the time now, and where people used to gather together and, in church, women's clubs and church basements for socials, that's disappeared. Often people are spending a whole day, they never see anybody, and they order groceries online, they're working remotely. And so groups, first and foremost, prevent loneliness. And I ran a group for many years. It was in oncologist's office that I would go in, I would clear out their staff dining room, and people would come. And I remember one woman, and it was Medicare wasn't paying for it, even though I took Medicare, but they would just pay what you can. This woman would count out, $5 in dollar bills, but that group was her lifeline. And a caretaker took her to the group. These were mostly older people, but she thrived in that group. And anything was on the table to talk about. I brought in my blender. They learned how to make smoothies. They started separate walking groups. And it was really miraculous to see the changes they made, because they were changing together. And so we teach our students how to facilitate groups, which is an art. And people often are scared because they can't do it. They think it's public speaking, but it's not. It's the same coaching strategies apply. You're listening to people in the group.
Yeah, I want to double click on that real quick, because I spent years being the guy at the dinner, looking at the yummy, freshly baked bread with like the whipped butter and the salt next to it, and having everyone just dive in. And I'm just like, feel sorry for yourself, right? And now I don't even blink. I'm just like that. I don't eat that. Right. But it took years of being the weirdo. It took years of being like, what's wrong with me? It took years of then meeting individuals who are also on the same boat, that also would suffer by eating the bread and the butter and no better. And knowing that I'm not this outcast weirdo with special needs that should feel sorry for themselves, but like, I'm just going to make that choice for me. And I know that makes sense. But it was really the group, the Sangha, the community, that helped reinforce it. Even for a guy like me who works hard, knows better, and I could will my way through it, I still caught myself having that emotional poutiness about the ice cream or the bread and the French stuff. And so this idea of being able to be with like-minded people and understanding you're not alone, I think is also, to your point, no one goes to church. So where are you going to get it? And so these group dynamics, I think, are critically important, especially in a world where our healthcare, you don't even have time. Like grandma doesn't know anymore. Like nobody knows what to say. Yeah. And so you don't even know where to get your health advice.
Such an important point, and groups fill that need. I've seen it so many times. Back in the 70s, when I had my classroom, the kids had special needs, and I saw that parents had needs. And so I actually started an evening group where the parents would come into the classroom. The school was up, they sat on their little chairs, but to see that they had support. So when some parents started to cry about their child was never invited to birthday parties, for example, and there were others in the group that had been there. And that was very healing. And it's why Weight Watchers has always been so successful. It wasn't the diet, it was the group. There's the fact that you went to a meeting, AA, same thing. It's a sense of this is a community who gets you, and you feel safe and you feel comfortable and welcomed. And so it is heartwarming. And I think it appeals because, again, it appeals from the heart. It's not a cognitive process that you're going to go and hear a lecture. It is really heartwarming and heart-centered connections.
This is so important. I just It's funny. It's like a theme this week. I just did a talk with my urban monks about all this, like the microbiota in the soil and how important it is for your health. And I was looking at like creams and things, ways to get these like soil-based organisms into the body, and trying to get all technical and geeky about it. I'm like, or you can just go outside.
Yes.
Right. And
Yeah.
so this whole conversation around AI and all this like crazy, like we should raise $1 trillion and go do AI by ourselves on Mars. Right. Or maybe fold back on our humanity, go for a walk and be with groups and talk to people who actually are people. So it's just really refreshing to have this conversation with you at this juncture in a world that's starting to untether from its humanity and its natural roots. People helping people. Fancy that.
Yes. Yep. Who would have thought?
Who would have thunk it, right? Sandy, tell us about your new book, and tell us where people can find you if they want to consider doing this type of training for health coaching.
The book is Your Health Coach Will See You Now. It's available on barnesandnoble.com, Amazon, and it is an argument for the importance of health coaching, research-based, and we need millions of health coaches. So you can find me. The website is functionalmedicinecoaching.org. On Instagram, personally, I'm Dr. Sandy, that's DRSANDI, or Functional Med Coach.
Love it. And just, she's not tooting her own horn, but there's a million health coaching institutes that pop up everywhere, and they're all just doing the thing. Sandy went to the Institute for Functional Medicine, worked with Jeff and Mark and the bigs, and created the coaching program for the IFM. So just well credentialed, just adult stuff. So, there's a lot of people messing around out there. I don't want to put a spotlight on that. I want to put a spotlight on people that are doing the real work, that have the pedigree and really have the experience, and are helping people. So thank you for the work that you're doing, and thank you for staying in the game. We need you to stay in it for a little while longer, Sandy. We need more health coaches in this world.
Well, that's my intention. Well, thank you so much. And thank you for trusting in us for your own health coaches, your program.
They've been delightful. Thank you.